we are targeting a lot on preventive care. Data shows that there is exponential increase in cardiovascular diseases in the country, both in terms of morbidity, this is a disease burden, and also mortality. Deaths from cardiovascular diseases have continued to increase. And a lot of these diseases can actually be prevented by certain lifestyle measures that we can implement at minimal cost in the communities. So prevention is really the key message. And the theme for our conference this year is a heart team, where we want to encourage various players in the cardiovascular field to come together, to put their efforts together and be able to reduce the burden of cardiovascular diseases. One of the challenges we continue facing as cardiovascular health workers is not having enough resources in terms of human and other resources, equipment and so on. So we discuss how to optimize the use of the scarce resources that we have, but we also have an opportunity to interact with the authorities, be they national or county governments, to see how they can appropriately channel the scarce resources available for cardiovascular care to have optimal output and good outcome in patients that we treat.
Human capital for cardiovascular health is a big issue. We require, currently we have approximately 100 cardiologists in the entire country of about 50 million Kenyans. And out of those, perhaps maybe 15 or 20% are women. So we have a gender issue there because the training is rigorous, the duration of training is long. It takes about 10 years to train, or maybe 13 years to train a cardiologist, because you have 6 years of medical school, a year of internship, 3 years of residency, and then 3 years of fellowship. So it's a long, rigorous process. So there requires some significant input in terms of enablement or enabling in the training environment and opportunities to favor a gender balance in that particular field of work. We also require, in terms of human resource, supportive staff. So we require nurses trained in cardiac interventions, we require clinical officers, people trained in cardiac imaging. So for every single cardiologist that you have, you probably need another 5 to 10 paramedical personnel to enable that wholesome delivery of that healthcare. So the risk factors for cardiovascular diseases are with us because they are mainly related to our lifestyles, our changing lifestyles. We are becoming more sedentary, we don't walk as much, we don't exercise as much, we're using vehicular transport, we're using a lot of motorbikes where we would ordinarily have walked, which is reducing physical exercise for most of us. Our diet has also changed. We are tending to eat more oily food, we are tending to eat more refined food, so we're eating very finely ground maize meal, for example, for our ugalis, or even for wheat flour, we're using very refined flour. And we're also taking a lot of sugar. So those particular things increase the likelihood of developing cardiovascular disease, hypertension, diabetes, and obesity. Our weight, our body weight is increasing as we go across the population, which increases the risk of cardiovascular disease.